Interesting.
Beautiful, too. Well, these are the most talked about pharmaceuticals of the last few years. We've been just talking about it during the commercial break. GLP-1s are diabetes drugs that are exploding in popularity because they also help everybody lose weight.
Yep, and now the World Health Organization is recommending GLP-1 medications for adults who are trying to manage obesity. So you may be wondering, is a GLP-1 right for you? UW Health's Dr. Jeff Potoff is here for his weekly visit. Hi, Dr. Potoff. Good to see you.
Good. Thanks for being here.
So this is really the topic du jour. I was just saying at my Thanksgiving table, there were probably 4 or 5 people at the table. They're all taking GLP-1s. It seems like everyone you know is. What is the significance of this World Health Organization recommendation? Does it mean now if you don't have diabetes, anyone can get a GLP-1?
Well, not so much, but I think what happens when the World Health Organization says things like this, which is, in addition to diet and exercise, they're not saying forgo those things. They're saying these medications can be helpful as a long-term strategy. Countries then change some of their health policy to say, you know what, we need to be thinking about weight loss as a bigger problem than just like, you're eating too much and you're exercising too little. There could be other things going on that these medications could help. I think on the pro side, that could help inform health policy. You might see more attention towards these drugs used in weight loss. 2, it could help in reducing the price. Like right now, these drugs are really expensive, sometimes $1,000 a month, which is quite a price to pay if you've got other things you need to afford. I think on the con, it could send this message that, like, wait a minute, I can eat my ultra-processed foods. I don't have to exercise. I don't have to worry about my diet. All I got to do is take more, Ozempic, Wegovy, things like that.
So I'm sorry, do you need to have a diabetes diagnosis in order to get a GLP-1?
Well, not necessarily. So to often be covered under insurance, a medication has to be have a proven indication that it works. So that's why you see these companies doing lots of studies to say, you know what, GLP-1s work great for diabetes. They have used GLP-1s for weight loss. They are usually under a different, brand name, but they're the same medications. But then you have to have a BMI that's like really high. I think where we're seeing people use these medications is they aren't necessarily morbidly obese, but they go online and they get, one of these companies to send them the medication. Lots of times they're paying out of pocket for that, and it will help you reduce weight.
Is that medication that they're just getting sent online legal and legit? Well, if it wasn't written by a prescription by their doctor?
I think it's probably, it's legal. It's not illegal to do that, but you do have to wonder, like, where is this stuff getting sourced from? Like, what quality controls are these medications going through? I think it's always better to maybe go through your healthcare provider, because there's other people who say, you know what, I did my own research and I think I need to be on this medication, when maybe you don't.
And what we didn't ask yet is, how do they work? It's very complicated, but it seems to be easy.
And do they all work the same?
Yeah.
Like, how do you know which one that you should take?
Yeah, all these GLPs are relatively the same. So a lot of it is, which one your insurance covers or which one you can get the cheapest. Some are a little bit more effective than others, but it's just a matter of a few percentage points. Largely speaking, they basically make you not feel like you're hungry. So you don't eat. They do some other things with insulin and how it works in the body, but they are legitimately effective. Most people who take them will lose some weight. There are a fair number of people, especially as you increase the dose though, that will get side effects. They can cause pretty bad nausea and vomiting, a little bit of abdominal pain. So it's not like they're 100% free lunch. That's why it's always best to use these medications under the direction of a physician. So you kind of know what you're getting into, what to look for, when to use them, when maybe to do other things.
So are they slowing your metabolism?
Not so much slowing your metabolism. Your body would still process your calories the same way, but there's parts of our brain that just make us feel hungry. I think we all get the munchies sometimes, and especially with like super yummy ultra-processed foods, they kind of take that desire away and you find yourself not eating as much.
Interesting.
But do you think people, like everybody will say, well, I want one. You know what I'm saying?
Yeah, where do we draw the line?
Like if I was I just said, I'd like to lose 20 pounds. Can I have one?
Right.
Are you dealing with that with patients?
I think a lot of it's out there. There's a lot of people on these medications, even without talking to their physician. I think the important message to weave through here is you might be able to lose weight, but I think if you're not eating well and you're not exercising, I don't know if those benefits that we see as far as reduction in heart disease, reduction in diabetes, things like that, I don't know if they carry over. There's lots of reasons why we need to eat healthy and exercise, and not just take a medicine. There is no magic pill yet.
Right, and we always hope there will be, but it's a good idea to check with your doctor.
Talk to your doctor.
Do the right things there. Thank you.
Very interesting. Thanks, Dr. Potoff. Good to see you.
Good to see you guys too.